If you're over 60, your body's needs and vulnerabilities change significantly, especially when it comes to vital organs like your kidneys. These hardworking organs play an essential role in filtering waste products, balancing fluids, and maintaining overall chemical equilibrium in your body. Yet, kidney function naturally declines with age, making it crucial to pay special attention to what you eat and drink. Many seniors focus on cutting down salt, processed foods, and sugary treats. But what if I told you that some fruits you might consider healthy, even beneficial, could actually be silently damaging your kidneys? Yes, you heard that right. Not all fruits are created equal, especially when it comes to kidney health in older adults. Fruits are generally packed with vitamins, antioxidants, fiber, and other nutrients that support overall well-being. However, as kidneys age and their filtering ability diminishes, certain fruits become a hidden threat. They can increase the risk of kidney damage, exacerbate pre-existing conditions, or interact dangerously with medications. Because kidney disease often progresses without obvious symptoms until it's advanced, many seniors don't realize that their fruit choices might be contributing to this silent decline. In this video, we're going to uncover 5 specific fruits that people over 60 should stop eating immediately to protect their kidney health. These fruits are common in many households, often seen as safe and nutritious, yet they contain compounds or nutrients that can overload or harm aging kidneys. Whether it's through excess potassium, toxic substances, or harmful interactions with medication, these fruits can silently undermine your health if you're not careful. By the end of this video, you'll know exactly which fruits to avoid, why they're harmful, and what alternatives you might consider instead. Your kidneys work tirelessly every day to keep you healthy, so let's give them the protection they deserve by making smarter food choices. If you find this information valuable, please subscribe and hit the notification bell to stay updated with more health tips specially tailored for seniors. Also, share your experiences in the comments below. Have you or a loved one noticed kidney issues related to diet? Let's support each other on this journey to healthier aging. Fruit 1. Grapefruit. Grapefruit is often celebrated as a powerhouse of nutrition, praised for its high vitamin C content, refreshing taste, and potential to aid in weight loss and immune support. Many health-conscious individuals, especially seniors, include grapefruit in their diet to boost antioxidant intake and improve heart health. However, despite its many benefits, grapefruit poses significant risks for kidney health, particularly for those over 60. This fruit contains compounds that can cause serious interactions with medications and place excessive strain on aging kidneys, potentially leading to long-term damage. One of the main concerns with grapefruit is its ability to interfere with the metabolism of various prescription medications. Grapefruit contains natural compounds known as furanocoumarins, which inhibit an important liver enzyme called cytochrome P450-3A4, CYP3A4. This enzyme is responsible for breaking down many drugs, including those commonly prescribed to older adults for blood pressure, cholesterol, heart conditions, and kidney health. When grapefruit inhibits CYP3A4, it prevents the normal breakdown of these medications, causing them to accumulate to dangerous levels in the bloodstream. This can result in severe side effects, toxicity, or reduced effectiveness of treatment. For seniors, this interaction is especially critical. High blood pressure and cardiovascular disease are prevalent in this age group, and many rely on medications like calcium channel blockers, e.g. amlodipine, statins for cholesterol, e.g. atorvastatin, and certain immunosuppressants or blood thinners. Grapefruit can cause these drugs to linger longer and at higher concentrations than intended, increasing the risk of complications such as dangerously low blood pressure, muscle damage, kidney injury, or bleeding. In cases where kidney function is already impaired, this effect can accelerate the decline of renal health. Moreover, grapefruit is relatively high in potassium, a mineral that plays an important role in muscle function and heart rhythm, but can be harmful when consumed in excess by individuals with reduced kidney function. The kidneys are responsible for maintaining potassium balance, but as their filtering capacity decreases with age or kidney disease, potassium can build up to toxic levels in the blood, leading to a condition called hyperkalemia. Symptoms of hyperkalemia may include muscle weakness, irregular heartbeat, fatigue, and, in severe cases, life-threatening cardiac arrest. Grapefruit's potassium content adds to this risk, especially when combined with medications that also affect potassium levels, such as ACE inhibitors or potassium-sparing diuretics. Another factor to consider is that grapefruit's acidity can sometimes irritate the digestive system or worsen acid reflux, which is common among seniors. While this is less directly linked to kidney damage, digestive discomfort can affect overall nutrition and hydration, both essential for kidney health. Given these concerns, many nephrologists and healthcare providers advise older adults, especially those with existing kidney problems or on multiple medications, to avoid grapefruit altogether. Even small amounts can trigger significant adverse reactions. It's not only fresh grapefruit that poses risks. Grapefruit juice, which is often consumed as a convenient health drink, carries the same compounds and dangers. If you enjoy citrus fruits and want to protect your kidneys, consider safer alternatives such as oranges, tangerines, or apples, but even then, moderation is key. Always discuss your diet with your healthcare provider and inform them of any supplements or foods you regularly consume. Your provider can help you understand potential interactions and adjust medications accordingly. In summary, while grapefruit offers undeniable health benefits for many people, its ability to disrupt medication metabolism, contribute to high potassium levels, and stress the kidneys makes it a fruit to avoid for anyone over 60 who wants to preserve their kidney function. Prioritizing kidney-friendly foods and staying vigilant about drug-food interactions can help ensure a longer, healthier life with better kidney function. Fruit 2. Starfruit. Starfruit, also known as carambola, is a tropical fruit that stands out for its unique star-shaped slices and vibrant yellow color. Its sweet tart flavor and appealing look have made it increasingly popular in many parts of the world, often enjoyed fresh, juiced, or in salads and desserts. Starfruit is often promoted as a healthy, low-calorie option packed with vitamin C, antioxidants, and fiber. However, despite these positive attributes, starfruit is one of the most dangerous fruits for people over 60, especially those with any degree of kidney impairment. In fact, consuming starfruit can pose severe, sometimes life-threatening risks due to toxins it naturally contains. The primary reason starfruit is hazardous to seniors and those with kidney issues lies in a neurotoxin called caramboxin, which is unique to this fruit. Caramboxin is a neurotoxic amino acid that is normally filtered out and cleared by healthy kidneys. However, when kidney function declines, as is common with aging or chronic kidney disease, caramboxin accumulates in the blood and crosses the blood-brain barrier, causing neurological symptoms that can be mild or very severe. Even small amounts of starfruit can lead to poisoning in individuals with compromised kidneys. Cases of starfruit poisoning have been documented extensively in medical literature, primarily among patients with chronic kidney disease. Symptoms of starfruit toxicity range from mild confusion, hiccups, vomiting, and agitation to more serious effects such as seizures, loss of consciousness, and even death if left untreated. The problem is that many people are unaware of the risks starfruit poses to kidney patients until symptoms appear. Given that kidney function naturally declines with age, the elderly are particularly vulnerable. Moreover, starfruit can worsen kidney damage through its high oxalate content. Oxalates are naturally occurring substances found in many plant foods. When consumed in excess, oxalates can crystallize and form kidney stones or contribute to renal tissue injury. For seniors who already have reduced kidney filtration, additional oxalate burden can accelerate kidney damage or trigger painful episodes of kidney stones, further compromising renal function and causing severe discomfort. Unlike grapefruit, starfruit toxicity does not primarily involve drug interactions, but instead centers on its inherent neurotoxin and oxalate load. This means that even if you're not taking medications, eating starfruit can still be dangerous if your kidneys are not functioning well. This fact makes starfruit uniquely risky and important to avoid for anyone over 60, especially those with a history of kidney disease, diabetes, or hypertension, conditions that often accompany aging and put stress on the kidneys. Another troubling aspect of starfruit is that its toxicity is dose-dependent but can occur even with a small amount. Some patients have experienced symptoms after eating just 1 or 2 pieces. The toxin's effect is unpredictable and can vary based on individual kidney function and the amount consumed, so the safest choice is complete avoidance. Awareness about starfruit's risks is low, and some seniors may be unaware of their kidney impairment since early-stage kidney disease often shows no obvious symptoms. This silent nature of kidney decline means starfruit's dangers might go unnoticed until severe symptoms develop, leading to emergency hospitalization. This underlines the importance of routine kidney function testing for seniors and clear dietary guidance from healthcare providers. For those who love tropical fruits and are looking for kidney-safe alternatives, consider fruits like pears, apples, or berries, which provide antioxidants and fiber without the risks associated with starfruit. Always check with your healthcare team before introducing new fruits or supplements into your diet, especially if you have kidney issues or other chronic conditions. In conclusion, starfruit is one of the most hazardous fruits for individuals over 60 because of its potent neurotoxin caramboxin and high oxalate content. Its potential to cause serious neurological damage and worsen kidney function demands that seniors and kidney patients avoid it entirely. Protecting your kidneys means being informed about such hidden dangers in seemingly healthy foods. When it comes to starfruit, the best policy is simply to stop consuming it immediately to safeguard your health and well-being. Fruit 3. Bananas. Bananas are one of the most commonly consumed fruits worldwide, prized for their natural sweetness, convenience, and high nutritional value. Packed with essential vitamins and minerals such as potassium, vitamin C, vitamin B6, and dietary fiber, bananas are often recommended as part of a healthy diet. However, for individuals over 60, particularly those with compromised kidney function, bananas can pose hidden risks that are often overlooked. Despite their health benefits, bananas must be approached with caution, as excessive intake may silently damage kidneys and exacerbate underlying health problems. The primary concern with bananas for seniors revolves around their very high potassium content. Potassium is a crucial mineral involved in nerve transmission, muscle function, and fluid balance. While potassium is vital for maintaining heart and muscle health, too much potassium in the bloodstream, a condition known as hyperkalemia, can be dangerous, especially for older adults whose kidney function is declining. The kidneys are responsible for filtering excess potassium from the blood and excreting it through urine. When kidney function diminishes with age or due to chronic kidney disease, CKD, the body loses the ability to regulate potassium levels effectively. Hyperkalemia caused by excessive potassium intake can result in severe complications, including irregular heart rhythms, muscle weakness, paralysis, and, in extreme cases, sudden cardiac arrest. Because many seniors already have some degree of kidney impairment, consuming potassium-rich foods like bananas without monitoring can lead to potassium buildup in the blood. This makes bananas a potentially dangerous fruit for individuals over 60, especially if they have underlying conditions such as diabetes, hypertension, or cardiovascular disease, which commonly affect kidney health. Moreover, the risk is compounded by the fact that hyperkalemia symptoms can be subtle and easy to overlook in early stages. Symptoms such as fatigue, weakness, numbness, or palpitations may be mistaken for normal aging or other health issues. Without routine blood tests to check potassium levels, many seniors remain unaware of their elevated potassium status until they experience serious cardiac symptoms. This silent progression underscores the importance of dietary caution with potassium-rich foods like bananas. In addition to potassium concerns, bananas contain significant amounts of carbohydrates and natural sugars. For older adults managing diabetes or prediabetes, this can present an added challenge. While bananas have a moderate glycemic index and provide beneficial fiber, overconsumption may cause spikes in blood sugar levels, complicating glucose management and indirectly affecting kidney health. Poorly controlled blood sugar is a leading cause of diabetic nephropathy, a form of kidney damage. Therefore, seniors with diabetes should carefully monitor their banana intake in consultation with healthcare professionals. Another important consideration is medication interactions. Many seniors take medications such as ACE inhibitors, angiotensin receptor blockers, ARBs, or potassium-sparing diuretics to manage blood pressure or heart conditions. These medications can increase potassium levels in the blood. Combining these drugs with a diet high in potassium-rich fruits like bananas can dangerously elevate potassium levels, increasing the risk of hyperkalemia. Therefore, medication management and dietary potassium intake must be coordinated closely under medical supervision. Despite these risks, bananas are not inherently bad for everyone over 60. For seniors with normal kidney function and no hyperkalemia risk factors, bananas can be part of a balanced diet. They provide important nutrients that support energy, digestion, and cardiovascular health. However, the key lies in moderation and individual health status. For those with any signs of kidney impairment or high potassium, it's essential to limit or avoid bananas to prevent silent damage. To protect kidney health, seniors should aim for a diet that balances potassium intake and prioritize fruits and vegetables with lower potassium levels, such as apples, berries, grapes, and pineapples. Regular kidney function tests, blood potassium monitoring, and discussions with dietitians or doctors can help tailor dietary choices safely. Substituting bananas with kidney-friendly fruits reduces the risk of hyperkalemia and supports overall well-being. In conclusion, while bananas offer many nutritional benefits, their high potassium content makes them a potentially harmful fruit for seniors with declining kidney function or those at risk of hyperkalemia. Silent potassium buildup can lead to dangerous heart complications and worsen kidney health if ignored. Therefore, individuals over 60, especially those with chronic conditions affecting the kidneys or heart, should stop or limit banana consumption and seek medical advice for personalized dietary guidance. Protecting your kidneys means being mindful of hidden risks in common foods like bananas and making informed choices for a healthier, safer aging process. Fruit 4. Oranges and orange juice. Oranges and orange juice have long been celebrated as quintessential symbols of health and vitality. Rich in vitamin C, antioxidants, and various essential nutrients, they are often regarded as go-to choices for boosting immunity, improving skin health, and supporting overall wellness. However, for individuals over 60, especially those with declining kidney function, consuming oranges and orange juice can be a hidden danger that may silently damage the kidneys over time. Despite their popularity and perceived health benefits, the high potassium content and acidity of oranges demand caution and awareness among seniors. One of the primary reasons oranges and orange juice pose risks for older adults is their high potassium concentration. Like bananas, oranges are rich in potassium, an electrolyte that plays a vital role in nerve function, muscle contraction, and heart rhythm regulation. While potassium is essential for maintaining proper bodily functions, excess potassium in the bloodstream can lead to hyperkalemia, a potentially life-threatening condition that is particularly prevalent in seniors with reduced kidney function. The kidneys act as the body's natural filter, maintaining a delicate balance of electrolytes, including potassium. As kidney function declines with age or due to chronic diseases such as diabetes or hypertension, the kidney's ability to excrete excess potassium diminishes. When too much potassium accumulates in the blood, it disrupts the electrical signals that control heartbeats, leading to dangerous arrhythmias, muscle weakness, and even cardiac arrest if left untreated. This silent buildup of potassium is especially concerning in the elderly who may not experience overt symptoms until the condition becomes critical. Beyond potassium concerns, the acidity of oranges and orange juice presents additional challenges. Oranges are naturally acidic fruits containing citric acid and other organic acids that can exacerbate acid-base imbalances in individuals with compromised kidney function. When kidneys fail to effectively eliminate acid from the body, a condition called metabolic acidosis can develop. This condition forces the body to leach minerals like calcium from bones to neutralize excess acid, leading to bone demineralization, increased fracture risk, and further deterioration of kidney health. For seniors already at risk of chronic kidney disease, CKD, frequent consumption of acidic fruits like oranges may accelerate the progression of kidney damage. The combination of high potassium and acidity makes oranges and their juice a double-edged sword that can silently undermine kidney function if not moderated carefully. Another factor that complicates the consumption of oranges and orange juice among seniors is the sugar content, especially in commercial orange juice products. While fresh oranges contain natural sugars, orange juice, particularly store-bought varieties, is often high in concentrated sugars, either naturally present or added during processing. Excess sugar intake can worsen blood sugar control in individuals with diabetes, a leading cause of kidney disease in older adults. Poor glycemic control contributes to kidney damage by promoting inflammation and oxidative stress in renal tissues. Furthermore, orange juice lacks the fiber found in whole oranges, which helps regulate blood sugar absorption and improves digestive health. Drinking large quantities of orange juice can cause rapid spikes in blood glucose levels, burdening the kidneys and potentially hastening the decline of renal function in susceptible individuals. Seniors with diabetes or prediabetes should be especially cautious with orange juice consumption. Medication interactions further complicate the picture. Many older adults are prescribed drugs such as ACE inhibitors, angiotensin receptor blockers, ARBs, or potassium-sparing diuretics to manage blood pressure and protect kidney function. These medications can increase potassium retention, making high-potassium foods like oranges more hazardous when combined. Additionally, some medications may be affected by the acidic environment created by citrus fruits, altering drug absorption and efficacy. Given these risks, it is crucial for seniors over 60 to assess their consumption of oranges and orange juice carefully. While these fruits are nutritious, their potassium and acid load can pose silent threats to kidney health, especially for those with existing kidney impairment, diabetes, or heart conditions. Moderation, along with professional dietary guidance, is essential. For kidney health maintenance, seniors should consider substituting oranges with lower potassium, less acidic fruits such as apples, berries, or pears. These fruits provide valuable vitamins and antioxidants without overwhelming the kidneys with potassium or acid. When consuming orange juice, choosing freshly squeezed juice in small quantities or diluted forms may reduce sugar and acid impact, but should still be done cautiously. Regular monitoring of kidney function through blood tests, including serum potassium and creatinine levels, can help identify early signs of kidney strain before irreversible damage occurs. Additionally, working closely with healthcare providers and dietitians allows older adults to create personalized nutrition plans that consider medication regimens and individual health status. In summary, while oranges and orange juice offer undeniable health benefits, their high potassium content, acidity, and sugar levels make them potentially harmful for seniors, especially those with compromised kidney function or diabetes. The silent accumulation of potassium and acid in the body can gradually damage kidneys and increase cardiovascular risks. Therefore, individuals over 60 should limit or avoid excessive consumption of oranges and orange juice, seek professional advice, and explore kidney-friendly fruit alternatives to protect their renal health and overall well-being. Fruit 5. Dried fruits. Dried fruits such as raisins, dates, apricots, figs, and prunes have gained widespread popularity as convenient, nutrient-dense snacks. Packed with fiber, vitamins, minerals, and natural sugars, these dried fruits are often viewed as a healthy alternative to processed sweets and a source of quick energy. However, for individuals over the age of 60, particularly those with underlying kidney issues, dried fruits can represent a silent and underestimated threat to kidney health. Despite their many nutritional benefits, their concentrated nutrient and mineral content, especially potassium and sugar, can contribute to progressive kidney damage if consumed excessively. The key concern with dried fruits for seniors lies in their significantly concentrated potassium levels. Unlike fresh fruits, dried fruits undergo a dehydration process that removes water, condensing the natural sugars, vitamins, and minerals into a smaller, more calorie-dense form. This dehydration concentrates potassium, making dried fruits among the highest potassium foods available. For example, just a handful of raisins or dates can contain as much potassium as several servings of fresh fruit. While potassium is essential for vital physiological functions such as muscle contractions and heart rhythm regulation, too much potassium poses a grave risk for people with impaired kidney function, a common issue for seniors. The kidneys are responsible for filtering excess potassium from the bloodstream to maintain a healthy electrolyte balance. As kidney function declines with age or due to chronic conditions such as hypertension, diabetes, or chronic kidney disease (CKD), the ability to excrete potassium efficiently diminishes. This results in elevated potassium levels, a condition known as hyperkalemia, which can cause dangerous cardiac arrhythmias, muscle weakness, numbness, and, in severe cases, sudden cardiac arrest. Because dried fruits are so rich in potassium, their consumption can silently worsen potassium overload in older adults who may not even realize the damage until symptoms become severe. In addition to potassium concerns, dried fruits are high in natural sugars. The dehydration process increases the sugar concentration, making these fruits a potent source of simple carbohydrates. For seniors with diabetes or prediabetes, conditions that are particularly prevalent in older populations, consuming dried fruits in large amounts can lead to rapid spikes in blood glucose levels. Poor blood sugar control is a leading cause of kidney damage due to the harmful effects of chronic hyperglycemia on blood vessels and kidney tissues. Thus, excessive intake of dried fruits can indirectly accelerate kidney deterioration through the compounding effects of high blood sugar and hyperkalemia. Another overlooked issue with dried fruits is their phosphorus content. Phosphorus is a mineral essential for bone health and energy production, but like potassium, it can accumulate dangerously in the blood when kidney function is compromised. Many dried fruits contain moderate levels of phosphorus, and chronic excess phosphorus intake can lead to bone disorders, vascular calcification, and worsening kidney function. The balance of phosphorus and calcium is delicate, and an overload of phosphorus can leach calcium from bones, increasing the risk of osteoporosis and fractures, problems that are already heightened in seniors. Furthermore, dried fruits often contain added preservatives such as sulfur dioxide, which can cause allergic reactions or exacerbate respiratory problems in sensitive individuals. While these additives are not directly linked to kidney damage, they can affect overall health and well-being, potentially complicating management of chronic illnesses in older adults. Portion control is another critical factor when it comes to dried fruits and kidney health. Because dried fruits are calorie-dense and nutrient-packed, it is easy to consume excessive quantities in a short time, especially as they are often eaten as snacks or added to cereals, salads, and baked goods. Even a small serving can deliver a heavy load of potassium and sugar, quickly surpassing the recommended dietary limits for people with kidney issues. Seniors may underestimate these effects due to the natural label associated with dried fruits, assuming they are inherently safe regardless of quantity. To protect kidney health, seniors over 60 should approach dried fruit consumption with caution. It is advisable to limit intake significantly or avoid dried fruits altogether if diagnosed with chronic kidney disease or if blood tests reveal elevated potassium or phosphorus levels. Instead, choosing fresh fruits with lower potassium content, such as berries, apples, or peaches, can offer a safer and equally nutritious alternative. Moreover, hydration plays an essential role in how the body processes dried fruits. Because they are dehydrated, dried fruits do not provide the same fluid content as fresh fruits. Seniors, who are already at higher risk of dehydration, must be mindful to drink adequate water when consuming dried fruits. Insufficient hydration can exacerbate kidney strain and increase the risk of kidney stones and urinary tract infections. For those who enjoy dried fruits and do not have severe kidney problems, moderation and medical supervision are key. Consulting with a dietitian or nephrologist to tailor dietary potassium and phosphorus intake can help incorporate dried fruits safely without compromising kidney health. Blood tests such as serum potassium, phosphorus, and kidney function markers, creatinine and glomerular filtration rate should guide personalized dietary recommendations. In addition to limiting dried fruit consumption, seniors should focus on an overall kidney-friendly diet that includes low-potassium vegetables, lean proteins, whole grains, and plenty of water. Avoiding excessive salt, processed foods, and sugary snacks complements the goal of maintaining optimal kidney function and preventing disease progression. In summary, while dried fruits like raisins, dates, and apricots provide beneficial nutrients and fiber, their concentrated potassium, sugar, and phosphorus content can silently damage the kidneys in people over 60, especially those with existing kidney impairment or diabetes. The dehydration process amplifies the risks by condensing minerals and sugars into small servings that may easily exceed safe intake levels. To safeguard kidney health, seniors must exercise caution, practice portion control, stay well hydrated, and seek professional dietary guidance tailored to their individual health status. By making informed choices, older adults can enjoy the flavors and nutrients of fruits without compromising their kidneys' vital filtering functions and long-term wellness. As we age, maintaining optimal kidney health becomes increasingly critical, yet many seniors remain unaware of the hidden dietary risks that can accelerate kidney damage. The kidneys perform vital functions, filtering waste, balancing electrolytes like potassium and phosphorus, and regulating fluids in the body. Unfortunately, after the age of 60, natural declines in kidney function, combined with common chronic conditions such as hypertension and diabetes, place seniors at heightened risk for kidney impairment. This makes dietary vigilance essential to preserving kidney function and preventing serious complications. Throughout this comprehensive discussion, we examined 5 specific fruits that, while often celebrated for their nutritional value, can quietly and cumulatively damage the kidneys of older adults when consumed improperly or excessively. Grapefruit, starfruit, bananas, oranges and orange juice, and dried fruits like raisins and dates all pose particular challenges to kidney health due to their high concentrations of potassium, phosphorus, natural sugars, and other compounds that stressed kidneys struggle to process. Grapefruit is one such fruit with potent interactions. Not only does it contain high potassium levels, but it also interferes with critical kidney metabolized medications, including blood pressure and cholesterol drugs. This can unintentionally amplify medication effects or side effects, causing dangerous imbalances. Many seniors remain unaware of these interactions, making grapefruit a stealthy threat to their renal and overall health. Starfruit, often less common in Western diets but gaining popularity for its unique taste and appearance, is surprisingly toxic to individuals with impaired kidney function. This fruit contains neurotoxins that healthy kidneys can eliminate but accumulate to dangerous levels in those with kidney impairment, leading to severe neurological symptoms and even fatal outcomes. This makes starfruit unequivocally unsafe for seniors with reduced kidney function. Bananas, while widely considered a healthy staple due to their fiber and potassium content, can become a double-edged sword for seniors. The high potassium levels in bananas can contribute to hyperkalemia, a condition that causes irregular heartbeats and muscle weakness when potassium accumulates excessively in the blood. For seniors with even mild kidney decline, this risk is elevated, demanding moderation or avoidance depending on individual health status. Similarly, oranges and orange juice, prized for their vitamin C and refreshing flavor, also contain elevated potassium levels and natural acids that may irritate already compromised kidneys. Moreover, commercial orange juice often contains added sugars, compounding the burden on the kidneys and affecting blood sugar control in diabetic seniors. Awareness and portion control are critical here to avoid kidney strain. Finally, dried fruits such as raisins, dates, and apricots concentrate potassium, phosphorus, and sugars due to the dehydration process, presenting an often overlooked danger. Their nutrient density means even small servings can quickly push potassium and phosphorus intake beyond safe limits for seniors with kidney issues. Additionally, dried fruits' high sugar content poses a threat to blood glucose regulation, further risking kidney damage in diabetics. Collectively, these fruits highlight the importance of understanding not just the nutritional content of what we eat, but how age and health conditions affect our ability to process these foods safely. Seniors must recognize that healthy foods for the general population may not be universally beneficial, especially when kidney function is compromised. To protect kidney health, seniors should work closely with healthcare providers, including nephrologists and dietitians, to tailor a diet that considers individual kidney function, medication use, and comorbidities. Regular monitoring of kidney markers such as glomerular filtration rate, GFR, serum potassium and phosphorus levels will guide dietary adjustments and prevent complications. In many cases, limiting or avoiding these high-risk fruits can significantly reduce the burden on the kidneys and improve overall quality of life. Additionally, adopting an overall kidney-friendly diet emphasizing fresh, low-potassium fruits such as apples, berries, and peaches, vegetables, lean proteins, and adequate hydration is essential. Avoiding excess salt, processed foods, and added sugars complements kidney preservation efforts. Lifestyle factors, including regular physical activity, blood pressure control, and effective diabetes management, also play vital roles in slowing kidney decline. Ultimately, knowledge and proactive management are seniors' best defenses against silent kidney damage caused by seemingly innocent foods. By making informed dietary choices and respecting the unique needs of aging kidneys, individuals over 60 can safeguard their renal health, reduce the risk of complications like hyperkalemia and cardiovascular problems, and maintain vitality and independence longer. If you or a loved one is over 60, take this information seriously. Consult your healthcare team before making any drastic dietary changes, especially if you have pre-existing kidney conditions or chronic illnesses. Early intervention, thoughtful nutrition, and regular medical supervision are the cornerstones of healthy aging and kidney longevity. Remember, the choices you make about the fruits you eat, what may seem like small everyday decisions, can profoundly impact your kidney's ability to support your health and well-being. Stop these 5 fruits now if they pose a risk to your kidneys, and choose kidney-friendly alternatives to nourish your body safely. Your kidneys work tirelessly for you every day. Return the favor by protecting them wisely through your diet and lifestyle. If you found this information helpful, please make sure to share this article or video with your loved ones over 60, because protecting kidney health is a community effort. Don't forget to subscribe to our channel or follow us for more vital health tips tailored especially for seniors. And most importantly, talk to your healthcare provider today before making any major changes to your diet. Your kidneys will thank you. Stay informed, stay healthy, and take control of your well-being starting now.